Hi, I guess we are good to start now. So, good afternoon, everyone. I am Dr. Vikram Bedi. I am a consultant pediatrician and a neonatologist at Bedi Hospital, Chandigarh. It's a mother and child hospital, a super specialist hospital in Chandigarh. So, I would like to thank BabyChakra for this initiative and helping and parents basically understand this a very important problem which I guess all parents go through. So today we'll be talking about the diaper rash, the dreaded diaper rash, what it is basically, what is the prevention and what is the cure, right? So we have divided this session into two parts where we will talk about what the diaper rash is, the prevention and cure, and the second and a very important part would be the question and answers. So we've seen in the last 2 days we've received a lot of queries, and I'll try to answer that as much as possible because of limitation of the time which we have. Very good questions we've received till now, that which is better, okay, we should use a cloth or a diaper, which is the best diaper brand to prevent rash, what is the best cream. So we'll try to answer all those things as we go along with the session. So I'll start with what is diaper rash. So firstly, very important for mothers to know, diaper rash is a misnomer in a way कि जरूरी नहीं है कि हमने डाइपर पहनाया तो रैश आ रहा है एंड नैपी पहना रहे हैं तो डाइपर रैश नहीं आ thing which we have, the complaint of mothers which we have is okay, we are not putting diapers on, we have nappies on, and still the area is red, and then we tell them that it's diaper rash, and then they say कि हमने तो diaper पहनाया ही नहीं है. So we have to understand why is it called diaper rashes, because of the area involved. So any rash in the diaper wala area is called diaper rash, irrespective whether you have put a diaper on or not, right? So any redness or any inflamed skin, okay, a healthy newborn skin is pink, but when it becomes red, it is called as diaper rash, and it can be anywhere. It can be near the buttocks, it can be near the urine area. So it does not mean कि पीछे rash है so it's diaper rash, and if it's near the genitals it is not diaper rash. So once we know that diaper rash is due to the location, not due to whether we are wearing diaper or not. So now once we know what is diaper rash, we should know what are the causes. Causes basically, I would say the number one cause is sensitive skin. Not all babies would have diaper rashes, right? The babies, I would say out of 10, 2 babies would have diaper rashes, and usually it is seen that there is a lot of sensitivity involved. So a child who's having sensitive skin is prone to have a diaper rash. So if we see जिन बच्चों को diaper rash होते हैं, there is a link के the parents or in the family there is always some history of allergy or a sensitive skin. So number one cause is sensitive skin. Second cause is a wet skin, humid climate, and infrequent diaper changes. So if there's urine which is there, because we know babies na, they do not always cry after passing urine or stool. When the urine really starts irritating them, maybe in a diaper 2 या 3 बार urine हो गया, and that's the time where it really starts irritating them. That is the time that they give you some cues or they give you some hints that this is the time to change the diaper. So what happens is that urine which is there, now urine is very acidic. That acidic urine which is stuck to the diaper is attached to the skin, causes friction and causes rash to develop. So basically, urine infrequent diaper changes is one thing which causes a lot of problem. So if you know that your child is very prone to diaper rash, make sure that you are changing diapers very frequently. Do not wait for the baby to start crying. I would say ideally 5 to 7 diaper changes are required in babies who have a very sensitive diaper skin, right? So we talked about sensitive skin, we talked about the infrequent diaper changes. Now, what are the other signs? We have seen that sometimes the brand does not suit the baby. That can also be one worry. Okay, we are using this brand, and since we've changed to this brand, the diaper rashes have increased. So the child can be allergic to the cloth as well. Second thing is a ill-fitting diaper, right? If the diaper is very tight, what it does is, again, it causes a lot of friction between the cloth and the skin. Again, it can aggravate the diaper rash, right? And the last thing is that infection. Now, whenever the stool or the diaper is there for a long time, we know that our stool contains natural bacteria and the place is very humid, so that place is actually the best breeding ground for any bacteria or fungal, right? So important thing is that bacteria and fungus, they grow well in damp places, and in the body, that is the most damp place which is present there. So lastly, infection can also be a cause of diaper rash, so hence we need to be very aware about it, right? So what can it lead to? It can lead to skin peeling off, it can lead to a lot of rash in the baby, which in turn might cause loose motions, right? So diaper dealt with on time. So when do you see a doctor? You see a doctor when it's become very severe, when you see there are tiny specks of bleeding, कई बार ना skin छिल जाती है. That is the time you should rush to a doctor. If there are loose stools present along with the diaper rash, or if you see that the baby has started crying, this is the time that home remedies should not be encouraged. You should visit a doctor, right? All newborns are not same. We have to first realize that diaper was an advancement of the nappy, right? There is still some confusion कि nappy ही use करो, diaper मत use करो. That's not true for all kids. That's true for, I would say, 20% of kids who have sensitive skin. Some kids are allergic to nappies also, right? So for them, diaper is a better option. So number one is know your baby's skin. If your baby's skin is not that sensitive, but make sure that you are taking care of the diaper well. You are changing it frequently. Whenever you change, make sure apply some kind of a moisturizer. I always advise everyone कि coconut oil लगाओ after every diaper rash, after every diaper change, and leave the water sponging of the potty area towards wipes. In the western area, there's a thing known as wipe warmer. So that wipe warmer actually has a lot of significance because it is scientifically proven that cold water will cause more rash as compared to a warmer water. So always use warm water while cleaning the baby's diaper area, right? Change diaper frequently and know which brand suits. Now there is no one particular brand which I should say कि ये use करो and you will not have rash. Some baby is allergic to Himalaya, some baby might be allergic to Pampers, some might be allergic to Kiku. So use the product which suits your baby. Do not follow the trade के सारे ये use कर रहे हैं तो मैं ये use करूं, right? Another important thing for preventing diaper rash not be this kind of a rubbing motion while we are cleaning the diaper area. It should be a patting motion, right? Always pat on the skin. Do not rub it because rubbing will cause abrasion of the skin. Their skin is already very sensitive, and you will realize that if you start patting, the rash frequency and the intensity will immensely improve. So this is patting instead of rubbing causes a lot of, I would say, comfort to the baby, and it prevents the rash. We've already spoken that make sure that the diapers are not too tight. A tight diaper will always cause more diaper rash. So hence you should know what size you are using, and you should allow air time. राइट। एयर टाइम मतलब कि हवा लगने दो, डायपर को खुला छोड़ो आफ्टर यू हैव क्लीन द बेबी। दैट रियली हेल्प्स इन प्रिवेंटिंग द डायपर that really helps in preventing the diaper rash. And last thing is, I always say, as a preventive thing, use a moisturizer like a coconut oil. If you think that the baby's skin is sensitive, use a cream which has zinc oxide, right? Zinc oxide, like these diaper rash cream. If you think the skin is sensitive, you can use it randomly every day to prevent rashes, right? So these things are very important. I'll repeat: change diaper frequently, know the right size, know the baby's skin, make sure you are patting, not rubbing, make sure the temperature of the water is good, make sure that the wipes are of good quality. Sometimes a child is allergic to a specific type of the wipe which you are using. Make sure you are giving airtime, and make sure you are using a cream or a coconut oil. These things will really help you in preventing diaper rash, and it is also less painful for the baby, because you see जब diaper rash हो जाते हैं ना, the child starts screaming a lot, there's a lot of squeaking which is happening, and the child also cries while passing uh, stool or while passing wind. So these are the few points which I felt should be discussed. So I'll take the questions. There are many questions. I'll try to do justice as much as I can. So Revati Rajamani has asked, what causes diaper rash? So I started with the same thing. Diaper rash can be due to sensitive skin. It could be आप सब कुछ ठीक कर रहे हो, still the baby can have diaper rash because the skin is sensitive. It can be due to infrequent diaper changes. It can be due to tight diapers. It can be that the baby is allergic to the wipe or the diaper. It can be due to infection. And it could be sometimes there is a thing which is right. So this is a medical problem. That is why if the rashes are severe, you should go to the doctor and see them. So this is important. I hope I have answered your question. These are the common causes for diaper rashes. So Madhvi Kelra has written, any home remedies for diaper rash. Home remedies, basically, Akurba has written, should the baby's diet be changed during a diaper rash? Only if the diaper rash is due to allergy. Now, what happens is there's a thing called as transitional stools. Transitional stools क्या होते हैं? Whenever the baby, we change diet at around 6 months, we start complementary feeds. That is the time we see that the stool pattern changes a lot. So that time, sometimes a child is allergic to some kind of a product which we've introduced recently in the diet. Yes, at that time the food needs to be changed. So when you go to a doctor will always take a history if there's a frequent loose stool कि आपने कुछ diet में change तो नहीं किया है. Sometimes change of milk from formula milk or breast milk, we move towards the packet milk. We've seen that loose motions they get aggravated. Now, this is called milk allergy or any food allergy. Food allergy, yes, can 100% cause diabetes. This is a very good question, and the thing is that you would not be able to make it out. You have to go to a pediatrician, because if there is a history where we know that introduction of a food has increased the stool frequency and subsequently increased the rash, that food has to be stopped. No medicine is to be given. You stop that food, wait for a month, reintroduce the food again, and you will see that the allergy will slowly wean off. Okay, so Priya has asked, when should I call the doctor for the rashes? When the rash is severe, when the baby is in pain, when passing of urine or stool becomes very painful for a long time, and when there is a lot of loose stools associated with the rash, or there is bleeding, you start seeing blood, or you start seeing that the skin has scraped off. These are the signs that you have to see a doctor and you should not delay it. Number one thing in treating diaper rash is timing. So issue क्या है कि if you go at the right time and you're not too late, the diaper rash should settle in 2 to 3 days. But if you are late and you've reached that severe level, the diaper rash would take around 5 to 6 days to heal, no matter what medicines we start using. So timing of seeing a doctor is very important. Okay, so there's another good question, Asha. Are teething and diaper rash related? Yes, तो ये बहुत it's a common myth that we all pediatricians face के इसके तो दांत आ रहे हैं, that is why इसको लूज मोशन हो रहे हैं या रैश हो रहे हैं या फीवर हो रहा है या कफ कोल्ड हो रहा है. Number one thing is that is absolutely false. This is not true. दांत आ रहे हैं it does not mean कि कोई बुरी चीज आ रही है तो साथ में बीमारियां भी आएंगी. We have to realize that teething is a process where the teeth they are basically erupting from the gums, so it causes pain. And इसमें क्या होता है, the children they start mouthing, everything goes to the mouth, they use their fingers as a pacifier, they start biting and chewing the fingers. So and this is the time usually they start crawling also. So you will see that इस time पे there is a lot of unwanted materials and dirty things which are going into the mouth. Exposure to germs increases when they are teething because everything, even the, let's say, the cloth or mobile or anything which they come in contact with, they would want to chew it. So this is why जो है teething will cause introduction of many organism. So it is common but it is not normal. ऐसे नहीं है teething हो रहा है तो बीमार होंगे. अगर teething हो रही है, the child will take many things to the mouth. Make sure you are sanitizing things before it reaches the mouth and you will not have this problem. Hence, to conclude, teething and rash have no relation. Teething does not cause rash. The irritation which makes the child take on many things causes infection, and that in turn causes rash. Right? Okay. Another question. Manisha has asked, should the baby's diet be changed during a diaper rash? No. Only if we know that it's allergic. Suppose the diet is going the same, you've not changed anything in the diet, and the baby starts having loose stools. That means कि कुछ नई चीज नहीं दी, उसको एलर्जी नहीं है. The same things are going on. You don't need to change the diet. If you feel that yes, yesterday I started with, let's say, banana, and I start having frequent loose stools, or I change the brand of the milk and loose stools start ho gaye, then you can change the diet, stop that thing. Otherwise, continue with the same diet. Now, adding to this, diet may during loose stool we have to make sure that there is no dehydration, right? Dehydration नहीं होनी चाहिए. Do not force feed the baby. जितना ले रहे हैं उतना ठीक है, but make sure that fluids are going very well. Another mistake which usually we all do is that we start giving a lot of juices. During loose stool, we have to realize that we have to give sugar plus salt. Giving juices like the tropical, real, and all those cans, they are the worst. Giving meetha or just sweetened water is going to aggravate and going to increase the loose stools. So make sure you increase the fluids. Simple water would also do, but the best thing is sugar and salt वाली चीज आप ज्यादा दिया करो. Right? Okay. So Barkha has asked, can cloth diapers be an alternative? Very important question. This is one thing, one debate which we really come across कि diaper पहनाएं या nappy पहनाएं or langot as we call it is in Indian language. Number one thing is that there is both are equal, right? It is not that diapers are superior or langot is superior. Your baby's skin will decide which suits. So पहले लंगोट ही होते थे. The good part about langot or the nappies is it allows ventilation, so the rashes are less. But you have to wash it very frequently. You are washing it, you are using a detergent, that detergent itself can cause rash. So diaper was an advancement over the nappies, right? To get rid of those things, disposable diapers were started. So if the child, like I started in the beginning, कि 10 में से सिर्फ 2 बच्चों को डायपर पहनने की वजह से डायपर रैश होंगे. So for those 2 kids, nappies are advised. Otherwise, diapers can be continued. You do not need to worry about it. वो आप पहना सकते हो, right? So my verdict is both are equal. See what comforts you. Some parents who are busy, for them use diapers if there is no rash. Some who have a lot of help use nappies. Both, you have to be result oriented. जो rash कम दे रहा है वो use करो, right? Can cloth diapers, okay, so this is done. What types of wipes are best for the baby in case of a sore bottom? Jhalak has asked this. Okay, so now you'll see in the market there are many wipes present, fragrant, non-fragrant, all those things. So again, it's a hit and trial. We say now again the water wipes have come into fashion. Use anything. The main thing is you should know your baby's skin. कई बच्चों को even the non-fragrant water wipes causes allergy. कई बच्चों को fragrant wipes also do not cause allergy. So the only important thing which I want to tell here is the temperature of the wipes, right? The temperature of the wipes should not be cold. The temperature should be warm. So if you are using type or brand does not matter, whether you are using Destin cream, the B4 nappies, easy nappies, Siloderm mixies. So what do you have to basically know while doing this is, okay, you have to avoid using steroids, avoid using antifungals until the doctor has said so. You have to avoid using steroids, avoid using antifungals until the doctor has said so. What can be used as a over the counter medicine is zinc oxide. So zinc oxide is one thing that you have to apply. Usually all the diaper rash creams like these Lotus, Himalayas and all, they have zinc oxide. Right? Zinc oxide is one thing which really helps in rejuvenating the rash, in replenishing the skin, and further lessening the rash and taming the rash. So any cream which has zinc oxide only, like the other causes of diaper rash can be infective, which can be bacterial or fungal or yeast. उस केस में some doctors also prescribe Siloderm mixi. Basically, that's a combination of many things. It should not be encouraged until the rash is severe. It has antifungal properties and zinc oxide as well. So basically, these are the small things which need to be taken care of. These do not self-medicate because, like I said, timing is a very important thing in treating the rash because it can really make the baby's life and the mother's life really, really miserable. Okay, so there are still a lot of questions left. Is there any remedies to avoid diaper rash? I think I've covered that. बेबी को डाइपर के उतनी दूर ब्लैक हो जाता है. अब्दुल हैज आस्क्ड दिस. सो यस, तो डाइपर रैश के बाद ना समटाइम्स द स्किन गेट्स स्कार्ड and there is hyperpigmentation. The skin, when it heals, the area becomes a little dark. So इस केस में ना, this is a skin's property and you do not have to do anything. Time will heal. Just apply coconut oil. The blackened portion will settle down in 1 or 2 months. No fancy creams, nothing. Just let the body heal and ये अपने आप ठीक हो जाएगा. Right? Okay. So I'm getting a notification from the team that the time is over. So there are still many questions which are unanswered. I tried to be as short as possible so that I could take as many questions. I think any questions which comment in the section below, and we'll try to answer that. I hope it was a learning session. I am really great that it was a very interactive session and we got lots of questions, some of whom unfortunately we could not answer. So I would like to conclude by saying do not be very afraid